Now for a pause point review question. True or false? The goal blood pressure for diabetic patients is less than 140/90 in both the ADA 2016 and JNC 8 guidelines. The answer is true. Both the ADA and JNC 8 guidelines recommend a blood pressure of less than 140/90 for diabetic patients. Now back to the assessment and plan. For primary prevention of ASCVD, the patient is taking atorvastatin 20 mg by mouth every night and aspirin 81 mg by mouth daily. The ASCVD risk for this patient is calculated to be 24.9%. The goal is to reduce risk of future ASCVD. Our plan is to continue aspirin and increase the atorvastatin to 40 mg by mouth every night, which is a high-intensity dose. We would also like to order a new lipid panel since the last panel was in January. ADA 2016 recommends daily aspirin for diabetic patients older than 50 years old. ACC-AHA recommends a high-intensity statin for diabetic patients who are 40 to 75 years old with an ASCVD risk of equal to or greater than 7.5%. For monitoring, we would like a lipid panel every 12 weeks and for the patient to monitor for signs of myopathy every day. We would also like to follow up with the patient in 1 month. Now for our next pause point review question. What information is required to calculate ASCVD risk score? Select all that apply. The answer is gender, age, race, HDL cholesterol, total cholesterol, if they smoke or not, systolic blood pressure, and also if they're receiving treatment for hypertension or if they're diagnosed with diabetes. Now back to the assessment and plan. For irritable bowel syndrome, the patient is taking dicyclamine 10 mg by mouth twice a day. The patient is well controlled on this therapy because he is not experiencing any symptoms of IBS. Our goal is to prevent worsening of IBS and to keep his symptoms under control. We plan to continue dicyclamine 10 mg by mouth twice a day because he's controlled on this therapy. We would like to monitor for IBS symptoms, side effects, and anticholinergic effects. We would also like to follow up with the patient in 1 month. For GERD, the patient is taking Nexium 20 mg by mouth every morning. His condition is exacerbated by his obesity, alcohol consumption, and an unhealthy diet. He is not controlled on this therapy because he is still experiencing symptoms, such as heartburn. The goal of treatment is to reduce GERD symptoms and improve his quality of life. Our plan is to increase Nexium to 40 mg by mouth every morning and encourage the patient to decrease alcohol consumption and avoid acidic foods in the evening. We would like to increase the dose because his GERD is uncontrolled with the current regimen and he has multiple factors and medications that exacerbate the condition. For monitoring, the patient should be counseled to self-monitor for frequency of heartburn and regurgitation. We would like to follow up in 1 month for this condition.